also. So our next speaker, she has a special place in my heart. She is an associate professor and coordinator of gerontology graduate studies at St. Cloud State University. She brings plethora of knowledge and experience on gerontology that has helped many students like me to grow and support the older adults. So please welcome Dr. Phyllis Greenberg.
Thank you, Preeti, and thank you for the invitation. And I have to say, Preeti holds a special place in my heart. She's one of the first students that we had for teaching the advanced care planning facilitator course. And so I thought I would also sort of talk a little bit how I got into this personally and then kind of move into that professionally. I think in looking at the differences between my father's death experience and my mother's death experience really shows the importance and how much a gift an advanced care directive truly is. When my father died, even though he had been sick for a number of years, there's still that part of you, not the logical part of you, but the heart part of you that thinks that they're not going to die and not prepared. We had certainly an ample amount of time to prepare. And it's always sort of a surprise when that actually happens. We were not prepared at all, and nobody knew what to do. I was still pretty young at the time, even like funeral arrangements, and I'd never been to a funeral before and found out so much information just on that I had no idea, and end up having to plan everything on the spot. I'm Jewish and we do things very quickly, right? We don't have a matter of time. Usually people are buried within 24 or 48 hours. So you can see where having that advanced care directive would have certainly helped. And it doesn't really allow you that time to really kind of be the family member, to be the son, the daughter, the mother, the wife, the husband, the friend. You're more having to do all of these different things. And it really sort of delays, or I think impedes the grieving process. Many years later, when my mom had a sudden illness, and it went rather quickly, but I knew, especially from having taught this class, or we were just looking at teaching this class, what a difference it made. We had everything in line. I knew exactly what my mother wanted and made that known to all my siblings. And I will say that sometimes people think it is a benefit if you come from a large family because many people can do many things. But let me tell you, it's just more people to kind of muck things up. Before I started teaching at St. Cloud State, I was a gerontologist in the field, and I cannot tell you how many families I worked with where they were willing to sever relationships over a teacup, right? It's not really the teacup, it's just the most physical, tangible thing that everybody's sort of putting all of their angst and you did this to me and I did this to you. And this is what mom would want and this is what dad would want. And everybody has a different idea. And then there's always those family members that, as we say, come in the last 2 miles of the marathon, right? They weren't there for anything before, but they've got lots of opinions and lots of advice, but not really doing any of the work. The advanced care directive makes that known. So it's not the burden on one person to have to say, this is what needs to happen. This is what you have to do. It's already been written down. And it was, for the most part, other than, losing a parent, it was fairly smooth. And I think part of the philosophy that we use, and when I taught with my teaching partner, Dr. Patty Bresser, is that if you have a good life, you should have a good death as well. And it should be what you want it to be. And it's not always just for that person, but how they're thinking, how they can sort of gift what will be most meaningful to their family members and loved ones, because they're the ones who are left, right? And looking at what that grieving process is, as well as being respectful to that person. I have had an advanced care directive, and I agree with Emma completely that one needs to revisit it. I have seen what happens when they don't. For a person who wrote an advanced care directive and did not, and ended up having a very ugly divorce and did not change anything after that, And so then that person became the beneficiary for all of her funds and being able to make decisions. So make sure that it is who you want it to be. Teaching a class with students that ranged in age from 18 to about 70 is always interesting. Students who are 18 don't always think about this, whether they're thinking about it professionally or personally, and you do have to be at least 18 years of age to be able to sign a legal document, so to have for your own an advanced care directive. Really interesting perspectives. I do remember one story of the student passed the class, and I was at her graduation. She won a scholarship, and so she asked me to sit at the table with her and her parents. And I remember her talking in class saying that, because we ask our students to ask their family, you ask your parents, do they have an advanced care directive? And she was excited when her parents said that yes, they did. And then she said, oh, that's interesting. She said, well, who did you have as your healthcare proxy? And they told her it was her. Well, it was a surprise to her. I mean, these are not where you want surprises. And she goes, oh, great. She goes, well, can I take a look at it? No, no, we don't want to burden you with that. And she's going, but I have to make decisions. She goes, well, where is it located? In a safety deposit box. So anybody who does this know that's no, 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 right? It needs to know. So at the graduation ceremony, I did ask him, I said, so, we'll call her Katie. Katie said was so excited that you had the advanced care directive, but have you let her look at it yet? No, 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 we still haven't decided. And I'm thinking like, so we had a long discussion, and I did talk to her a few weeks after graduation, and they finally decided it didn't need to be in a safety deposit box, right? And that she could take a look at it so she could make the decisions. I think one of the more interesting things that we've looked at doing is pre-pandemic, we have an event that's called Project Homeless Connect, where we look at providing goods and services to people who are homeless or at risk of homelessness. And one of the things that we decided to make available was advanced care planning, and for people to be able to complete an advanced care directive, and students that were in the class could certainly help with that. There are a lot of people who are homeless that didn't think they could have it because, if you don't have an address, you can have an advanced care directive without having an address. We had people there who could, sign off on it, witness it. And you could see that gave a lot of like, to people who didn't think that they would be able to do that. I think the last thing I'll just add, a new field that's come into play in talking about that whole concept of good death are death doulas. It's actually my plan, that's my retirement plan, is to become a death doula. I have been with people when they've been born. I've been a birth coach, and I certainly have been with people when they have died. And it's oddly a very similar experience. It is, you welcome people into the world and you give permission and help people to leave. So it's all about that good death. It's going to happen, right? There are some things that we can count, as they always say, birth, death, and taxes. So birth, we've already done. Taxes, we continue to do. Won't get into that discussion. And then it's death, and it's the end, not just the end of life, but I think the whole idea of making it a good death and giving it as a gift is significant. And I too want to thank Priti and Catherine, sorry, for putting this together and inviting this great panel, because I'm very interested in listening to everybody else. So